Imagine you're dispatched to a park in the middle of July. It's 102 degrees outside, and you find your patient confused, sweating, or maybe they're not sweating at all. What do? Today we're going to cover hyperthermia, and we're going to cover heat cramps, heat exhaustion, and most importantly, heat stroke. By the end of this video, you're going to learn how to recognize each condition and figure out how to treat each condition as an EMS provider. So hyperthermia occurs when the body obtains more heat than what it can let off. And so normally your body's going to help try to compensate and try to get rid of some heat by sweating and by dilating your blood vessels to help increase blood flow going to the skin. When these mechanisms start to fail and the body's temperature starts to rise, this starts causing more damage to occur to the kidneys, the brain, the heart, and other organs as well. So anybody can develop hyperthermia, but it is more common in your elderly patients, your children, athletes, people who work outdoors, patients who take beta blockers or diuretics, patients who are dehydrated, and patients with heart disease. But I want you to make sure that you're using your provider judgment and using your environment to help paint a picture of what might be going on with your patient. And so now let's go ahead and start talking about the 3 different types of emergencies. And the first one that we're going to talk about are going to be heat cramps. Heat cramps are going to be the mildest of the 3 conditions that you can suffer from hyperthermia. And with heat cramps, you're going to see those body cramps. You're going to start seeing heavy sweat, and you're going to start seeing the patient become increasingly more thirsty. At this point, you might start seeing the body temperature slowly start to rise, and it might just be a degree or 2 above what's normal for your patient. And you're probably going to see that the patient is still mentating normally. They have normal mentation because this hasn't truly started to affect them quite yet. So as far as treating these patients, they don't typically require super aggressive, really advanced treatments. Typically, it's just going to be starting with getting them away from the hot environment, moving them from outside to inside, getting them into AC, getting them into the shade. If they're a construction worker and they're working on a property that doesn't have the AC turned on, maybe just get them outside in the shade and let the wind blow onto them. We also want to make sure that these patients are just resting and they're drinking their water and they're drinking electrolyte fluids, such as Gatorade, Powerade, things like that, the electrolyte packets, just kind of some things like that, really. And so we also want to maybe consider starting to stretch out these patients, stretch out those cramping muscles, and that might help in their comfort. So next up, we have heat exhaustion, and this is going to be the second one in that tier list. This isn't the most severe heat-related condition, but it is starting to get there, okay? So some signs and symptoms that you're going to start seeing with these patients, they're going to be heavily sweating. They're probably going to start being confused, they're going to be nauseous, they're going to be vomiting, they're going to feel weak, and they're going to be tachycardic. So at this point, their body temperature is going to be elevated above normal, but it will still be below 104 degrees Fahrenheit. And at this point, the patient, they're also going to be mentating pretty normally as well. The way we're going to treat this condition is we want to stop work. We want to get this patient to rest. We want to get them out of the sun or out of that hot environment and into the shade, or preferably into an air-conditioned area, even if that means getting them into your car and turning on the AC. That is going to be that air-conditioned area that they're going to very desperately need, okay? For these patients with heat exhaustion, we want to start actively cooling them. We want to start removing their clothing, taking off their jackets, their shirts, maybe start considering taking off their pants. And we also want to make sure that we are getting some ice packs on them, some cold packs, some ice, cold water. And we want to start putting these ice packs into the large blood vessel areas, such as your neck, your armpits, your groin, where those really big blood vessels are, to start cooling those blood vessels, and that'll start cooling the blood that goes to the rest of the body. We can also get fans on this patient, or we can start spraying them with a mist, get a water bottle, a spray bottle, and put it to the mist setting, and just start spraying them with this mist, just getting some cooling water onto them. If the patient is able to tolerate fluids, we want to start to make sure that we're getting it orally, and so the water, the Gatorades, the electrolytes, get all that stuff down orally, let them swallow it. But if they're nauseous and vomiting, we're probably going to start needing to think about getting an IV if we haven't already got one. And so we want to make sure that we're getting in an IV for this patient and getting them some IV fluids. It can be room temperature fluids, but preferably let's get them some cooler fluids. Let's get it out the icebox, out of the cold, the fridge that's in the ambulance, and let's go ahead and use those cold fluids on our patient. Of course, always follow your protocol when it comes to stuff like this. So at this point, we're going to be getting the patient to the hospital, but we really want to make sure that we're monitoring them because heat exhaustion can turn into heat stroke within about 10-15 minutes if it goes untreated or if there was a delay in treatment. So very, very heavily monitor these patients and watch out for the change in mental status. And so now we do have heat stroke, and this is going to be a true medical emergency. They're all very significant, but this one will kill your patient. And so we need to start making sure that we're treating it very aggressively. Now, to recognize heat stroke, you're going to start seeing, or the symptoms are going to start with all of the ones that were in heat exhaustion. But now we're going to start seeing some new things. We're going to start seeing altered mental status, agitation. You know, we might start seeing the patient, they're no longer sweating. And it might be hard to tell if the patient's still sweating or not. And so what we can do is just dry already wet area, an area that's wet with sweat, dry that off, take the clothing off, and see if they keep sweating. See if they sweat in that new spot that was now dry. If it stays dry, then they're probably, if you haven't decided already, they're probably in that heat stroke. We're also going to be looking for tachycardia, hypotension. Seizures are going to start to occur at this point. And so remember, altered mental status is going to be that big change from heat exhaustion to heat stroke, but there are some other changes in there that should be starting to trigger something in your mind to think, maybe this is starting to be heat stroke. And so, of course, the way that we're going to treat this, with every patient, we're going to start with our ABCs, giving them oxygen if needed, fixing the ABC problems if needed. We want to go ahead and check a sugar as well, because altered mental status could also be a sugar issue. A hot temperature could also be a sugar issue. So just go ahead and check that and rule that out as well. We want to begin cardiac monitoring. We want to make sure that we're getting an IV if we haven't already. And if we can't get an IV, this patient still needs to be cooled. We need to prepare for the worst. And so this is a patient where it's definitely justified to just get a conscious IO on them. You know, use your lidocaine, use your Versed, use your fentanyl just to help with the pain, because IOs, they are going to hurt this patient. And so we're going to do these things in the right order to make sure that we're hurting the patient the least amount possible. But we need to get some sort of access on them. And if we can't get the IV for whatever reason, we need to make sure we're getting the IOs. Our goal for this patient is to lower their body temperature as quickly as possible, okay? And so keep with the ice packs, get the cold fluids on them, get the cold fluids inside of them through those IVs, through those IOs. If you have a cold water immersion tank, you know, a dip tank, something like that, then go ahead and use it. That's going to be perfectly appropriate for this patient. You know, if you can get bags of ice from the corner store, you know, use those as well. If you can get it out the ice chest on the construction site, pull it out of there. We need to cool this patient as quickly as possible. Now, the problem with this patient is that they're really hot. And so if we can treat them on scene, if we can cool them as much as possible on scene, let's go ahead and do that. It's probably going to be really hard to bring that immersion tank with you in the back of the ambulance and still have the patient strapped down to the stretcher. So let's cool them on scene, and then let's start transporting while we continue to cool them. But we can do most of our cooling on scene if needed. Use your best judgment when it comes to something like this though. Now, the biggest issue with cooling the patient too quickly is they can start to have seizures, but that is going to be okay. In this case, that's going to be okay. We almost expect it, and so that's why we're also making sure that we're getting the IVs and the IOs and calling ALS if we aren't ALS ourselves. Because if a seizure occurs from cooling this patient too quickly, we know exactly what to do. ABCs, and then give them, you know, a benzo, something like Versed, you know, and then just go ahead and continue on with the cooling while we're transporting. So when we're going ahead and we're assessing these patients, there's a few questions that we want to kind of keep in mind while we're assessing them. And if we can't ask them, make sure that we're asking a bystander. One of the questions that we're going to ask are, you know, have they been eating and drinking normally? Has their water intake been up? What kind of fluids are they drinking? About how many bottles of water, how many bottles of Gatorade have they drank today, starting from a specific time. You know, when they came into work at 9 o'clock this morning, how many bottles of water have they drank now? You know, we can also start asking about alcohol use, alcohol and drug use, because that stuff can also cause dehydration for your patient. And so that might tell us that we need to more aggressively hydrate this patient. Another question that we want to ask them is, how long have they been outside? What kind of activities were they doing while they were outside? And then of course, your regular sample OPQRST questions as well. And then for these patients, you want to make sure that you're always getting your full set of vitals, your temperature, your sugar, your blood pressure, your heart rate, get an end tidal reading, get at least a 4 lead on, preferably a 12 lead on them for that cardiac monitoring. Get the AVPU, do a stroke scale, and just really make sure that we're ruling out everything else that we can. And so some common mistakes that a lot of EMS providers make, especially when they're first starting out, is they wait too long to start aggressively cooling the patient, because like I said, heat exhaustion can turn into heat stroke within about 10-15 minutes. So actively cool this patient, do it aggressively as well. Another thing is treating heat exhaustion and heat stroke like it's just simple dehydration. That is part of it, but there's also this other thing that's going on, that's the heat. And so we need to make sure that we're cooling as well as getting the fluids. And a big thing I want to say is that with heat stroke, yeah, oftentimes they do stop sweating, but they don't have to stop sweating. They can still be sweating, but they're now in heat stroke. And so we're going to see that altered mental status, but they're still sweating. They are still in heat stroke. And so we need to make sure that we're calling it what it is. So really, that's basically coming to the end of this video. There are some things that I want you to remember though. And so the first thing being is heat cramps is the most mild condition for a heat-related emergency, and it requires the most mild treatments. Heat exhaustion, now we're starting to get more advanced and more aggressive with our treatments. We're going to start actively cooling this patient, and we're going to have to heavily monitor this patient to make sure they don't progress to the third thing, which is heat stroke. And with heat stroke, we need to remember that it is going to be a life-threatening emergency, and so we need to be very aggressive with our treatments and cooling this patient off as quickly as possible to give them the best chance of survival. So that's it for this video. If you haven't already, please go ahead and like, comment, subscribe, share. You know, that would help us out quite a bit. But also don't forget that we do offer EMT and advanced EMT courses with our partnership with Texas Rescue Med, and all of that information can be found on our website. Hope this helped. Y'all take care. See ya.